My name's David Marks. I'm a consultant spine surgeon based at the Royal Orthopaedic Hospital in Birmingham in England, but also working at the Birmingham Children's Hospital. And most of my work is with children with curved spines. I met Ruby about 2 to 3 years ago, and she was referred to our clinic with a neuromuscular type of scoliosis, a form called spinal muscular atrophy. That can be one of the worst types of scoliosis that we see because the spinal muscle and nerves don't develop properly. Ruby had a large curve, over 60 degrees in curvature to the side when she came to us. She was in a wheelchair, and part of the condition is that it affects all the muscles of the skeleton. Ruby is a very engaging young lady. She is very questioning. She's very bright and very positive, and she understood and she was involved in the discussions, even though she's young, about her surgery.
My name's Philippa Crowther. I'm Ruby's mother. Well, Ruby's a very bright little girl, very intelligent. She attends a mainstream school. She's funny, got a very adult sense of humour, and very positive, very happy, I would say, most of the time. Spinal muscular atrophy is a condition that's genetic. There's 4 types of it. Ruby's got type 2, and it basically means that she's got a missing protein. She's got a deletion in her genetic makeup. It's the SMN2 protein that's deleted, which in layman's terms means that she's not carrying enough messages. There's not enough protein to carry the messages fully from the nerve to the muscles. So therefore some of the muscles waste, which is where the atrophy comes from. So she's got some protein, but not enough. So she's never walked and won't walk. And we've really got to work on keeping the muscles that are working strong. Ruby's developed scoliosis because obviously of the condition, and the wasting of the muscles means that she hasn't got enough muscle strength to hold her spine straight, and it starts curving. And once it does start curving, there's nothing you can do to stop it curving. Caring for Ruby is a full-time job, because Ruby doesn't sleep through the night, so she needs me to get up to move her or make her comfortable. She could be too hot or thirsty, and she gets some leg pain. But she attends a mainstream school, so that's where I get a little bit of a break. And she's great, she's great company. So it's not a chore caring for her, but she's very demanding.
Ruby had undergone some treatments prior to our contact with her, but they were not spinal treatments. We debated with Ruby and her family whether she would be suitable for a brace, but unfortunately, a lot of the patients with SMA, spinal muscular atrophy, can't tolerate a brace because it affects their breathing. So in Ruby's case, given the size of her curve, it was fairly clear-cut that we would offer her surgery, and we chose the Shilla procedure for that. Shilla was chosen for Ruby because she's small and she's young and she still has growth of her spine, but her curve was getting larger and we needed to control it. So we wanted a technique that would give us control of the curve and allow her to continue to grow, but not mean that she had to come back for repeated operations.
The doctors explained everything to me on my own, and the anaesthetist did as well. And obviously I didn't share that with Ruby. I just took on board what they were going to do. And from Ruby's point of view, Josephine explained it to her, and I think that was great. And probably I'd have been better off just having Josephine without all the details, because sometimes I think too much detail is a bit scary. Josephine is a giraffe, which you unzip from the neck down to the bottom of the spine, and it shows a scoliosis. So I suppose from a child's point of view, or an educational point of view, it just makes it less scary than seeing someone's back being operated on. And it's a good way to explain to children what a scoliosis is and what the aim is to try and straighten it, because you're not getting it dead straight when you have the surgery. What you're trying to do is train the spine to grow straight.
The key to Josephine is it allows the parents to explain to their children in the home situation about scoliosis in simple terms. It was written with 4-, 5- and 6-year-olds in mind, and it follows the story of Josephine, who's a tomboy female giraffe who is very active but has been asked to see the doctor because she has a curve on her back. And it takes the story of Josephine and her friends through to the decisions about treatment.
I like Josephine the Giraffe. There's an elephant, there's a hippo, there's a monkey, and there's a parrot. She has loads of friends.
We get to read the literature and Ruby gets to see her, and then she had her photo taken with her.
I took the leaflet into school and showed everybody what I will have that the giraffe had.
Ruby was the first person to use Josephine, and I think, well, certainly the way she was when she went down for a surgery, she was incredibly calm, and I think it took a lot of the scary bits away for her, because she didn't really bat an eyelid going down. I thought she'd be very scared and upset and all those things, and she wasn't at all. She was talking to the anaesthetist all the way down. You know, they asked her what anaesthetic she wanted. She was smiling. You know, I was a mess, and she was great. She was great. So I think for her, you know, it made it far less scary and made it simple to understand.
She showed me what was going to happen to me and made me calm of what they're going to do to my back.
Ruby went in for the surgery on June the 5th last year, 2013, and she recovered brilliantly, really. She went into intensive care afterwards and then went on to a ward, and 8 days later we took her home. And from then it's really been, you know, just building her up. Like Ruby's curve was 110 degrees. It's now 50, I think it's 51. So that's a massive improvement. If you can imagine how bad it was before, you know, that's massive improvement.
Before, I couldn't hold my head and I couldn't balance. I needed someone to hold me, and I had to hold my head like this. But now I can just hold my head normally and balance more.
Well, Ruby now can sit unaided. She couldn't sit on her own before, and I think her chest, where it was quite almost concave looking, is now filled out, and she's almost looking, not plump, but she's almost looking, you know, chunkier. Certainly, she looks like she's got a lot more muscle tone around there, and we've had no chest infections. And obviously chest infections are the real danger area for Rubes. We've had none.
It's better to go swimming because I can move my arms more and they get more strong in the water. Well, we went swimming with dolphins, and our dolphin was called Jenny, and she was in her late 30s, and she had 4 babies.
Yeah, I would definitely recommend Jo the Giraffe, because I think it's a much easier way to explain it to children. I mean, they're bright children. I think children aren't stupid. They know something major's coming, and I think you do need to explain it to them, but in a way that they can understand. You know, it's not filled with medical jargon, it's a cuddly toy. They can unzip it, they can look at a scoliosis, and it just makes it far, far less frightening, I think.
Josephine has made me really, really happy out of my treatment.